promoted one of the top plastic surgeons in the country, probably in the universe, and I'm so excited to have him with us right now. Welcome to the show, Dr. Greenberg.
Thank you so much for having me, Donna.
So I have watched a lot of your career over the years because we're both Long Islanders, and I just want to tell you congratulations.
Thank you.
You have built an extraordinary practice, and you have helped thousands and thousands of people. So on behalf of those behind the scenes that are going, yay, you, yay.
Well, thank you so much. You know, I take so much pride in taking great care of patients and providing the best in invasive and non-invasive cosmetic surgery procedures. And, you know, it's just my passion. I love to do it, and I love to make patients happy.
Why did you choose plastic surgery as your career?
You know, I think plastic surgery allows me to operate on a whole slew of different types of patient populations. It's not just women, it's all age women, it's men, it's children, and you can operate on every aspect of the body. So I do everything from head to toe.
I was telling you earlier that I went to art school. So you and I both have this, I guess, an affinity for the human form. Yeah, and you see it as an art canvas, correct?
For sure. I think the human body is, you know, for me, it's artistry, and it's molding and shaping and really seeing what people want and want to change. And I think that so many things in my career over the last 25 years have changed where we can make minor differences that go a long way, or we can make major things happen for patients, but it changes their life. It changes the way they feel about themselves. All of a sudden, patients have confidence, and they're out there in the marketplace, and they're to work or getting new husbands or wives or boyfriends or whatever that is. I can really help to change somebody's perspective on themselves, whether we do little things or big things.
And it's also from the inside out. I know that your patient advocacy is so wonderful, like your bedside manner is so important. You actually kind of consult with each person individually to talk to them about what their goals and aspirations are.
Yeah, for sure. I think bonding with patients, you know, this is the way I am with a patient in a consultation. I sit down next to them, I listen to them, and I want to hear what's bothering them. It's not what I want, it's what they want. So I think that physician-patient sort of bond is very important to kind of figure out what's best for each and every person individually.
You're also known for your innovation. You have wonderful equipment. You also do 3D imaging. How does 3D imaging work for you in your office?
My office is space age.
Okay.
So whether you're in Woodbury on Long Island or Manhattan or Southampton or Boca or Smithtown, wherever we are, and I have 5 offices now, I really am all about state of the art. It's when you walk into the office, it's unbelievable. The experience is unbelievable, and the technology is unbelievable. 3D imaging allows patients to see what they're going to look like. I actually do 3D imaging for the body, the face, and we're doing scans of the face even now to show people what they're going to look like in 5 and 10 and 15 years down the line.
Wow.
Without treatment. So I can see the future, what they're going to look like, and fix it now.
Lovely. Lovely. I always know that my best feature for myself has always been my eyes. But I do know that
They're
as a
amazing, by the way.
Really?
Your eyes are awesome.
I thank you. Thank you so much. That makes me feel really good coming from you because you see lots and lots of eyes. But I do know, and I also have been watching, especially as a newscaster, you know, certain things that over time you might want a little something, right? Because so you work with celebrities. You yourself are a celebrity now, but you work on celebrities. You work on everyday people. Like you said, people that are going through life changes. Sometimes, you know, through no fault of their own, you know, maybe an accident occurs or something, and you can also do restorative looks.
Yeah, for sure. You know, I do the celebrities and I do the person next door. And I treat them all the same. Whether you're a major movie star and you're coming in, or whether you're just the mom next door and want something done, everyone's treated the same. We spend tons of time with them. We use the technology. But you're right. We can fix somebody's eyes. And for me, the eyes give away age more than anything else on the face. But we look at the whole body and the whole face and we say, okay, can we just get away with minor things? Little laser treatments, injections, a little pull up here or there, fixing somebody's eyes or doing a little mini lift can take years off of somebody's appearance, and the downtime is not like it used to be. Very quick, patients go back to normal activities so fast now.
Yeah, you have your own way of recovery. You have your own distinct recovery process. We don't have to go on that here, but that is one of the other things that you're really known for. You know, I love tracing my family tree, my genealogy, and that was one of the things that specifically, I worked with Christine Baranski recently, and she's just so gorgeous, and she's doing a new show about the Gilded Age. And I started looking at photos from like the late 1800s, early 1900s, and that's what prompted me to call you, because I looked at them and I was like, why am I aging differently at the age of, I'm going to be 55, compared to my ancestors and the way that they looked? They didn't have like the angry 11. They didn't have some things. Why are we aging differently now, do you think?
First of all, I'm glad I wasn't a plastic surgeon back there in those days, because things were different.
Okay.
People weren't aging as much as they're aging now. I think it has to do with stress. I think it has to do with environmental things. Probably has to do with some dietary things, the chemicals that we're all consuming. So there's a lot of different factors now where we tend to age a little bit more. But thankfully now we can reverse a lot of those signs of aging that we weren't able to do years ago. Even 5, 10 years ago from what I do now is completely different, because technology now has helped us. You mentioned before about recovery.
Yes.
With my Greenberg rapid recovery systems that we do, I can get patients back to work and normal activities in 24 hours with a breast augmentation, liposuction, even little mini facelifts. Last week I got a patient back to work in 24 hours, a little makeup on, little facelift, and she was back to normal activities.
Wow.
So things have radically changed.
Yeah, you have the little thing that's called like your lunch hour makeovers or something.
Yes, yeah, we do. We have patients come in on their lunchtime. We do a little injections. We do some skin tightening, and back to work they go.
Lovely. I thank you so much for being here. Like I said, I honor and respect and admire you so much. So thank you for taking the time. And I know you're on your way to surgery today.
Yes.
But Dr. Greenberg, thank you so very, very much.
And thank you for having me, Donna.
And you have a new book coming out, right?
Yes, I do. It will be coming out in the next couple of months.
Excellent. Thank you so much. Dr. Stephen Greenberg has been with us. Please go to his website for more information. This is Donna Drake, staying healthy.